As a French Bulldog owner, it's important to be aware of the potential health issues that your furry friend may face. One of the most common health problems in French Bulldogs is Intervertebral Disc Disease, IVDD. In this video, we'll look closer at IVDD in French Bulldogs, including its causes, symptoms, treatment options, and prevention measures. What is IVDD? Intervertebral Disc Disease, or IVDD, is a condition that affects the spinal cord in dogs. The intervertebral discs that separate the vertebrae in the spine can bulge or rupture, causing compression on the spinal cord. This can lead to a variety of neurological symptoms and mobility issues. Risk factors of IVDD. While the exact cause of IVDD in French Bulldogs is unknown, several risk factors can increase the likelihood of the condition. These risk factors include genetics. French Bulldogs are more prone to IVDD due to their genetic makeup and breed history. Age. IVDD is more common in older French Bulldogs, although it can occur in dogs of any age. Weight. Overweight French Bulldogs are at a higher risk of developing IVDD due to the added pressure on their spine. Trauma. Trauma to the spine, such as a fall or accident, can increase the risk of IVDD. Signs and symptoms of IVDD in French Bulldogs. The signs and symptoms of IVDD in French Bulldogs can vary depending on the severity and location of the disc disease. Some common signs to look out for include difficulty walking or standing, hunched back or an arched spine, pain or discomfort when touched or picked up, weakness in the hind legs, inability to control bladder or bowel movements. If you notice any of these symptoms in your French Bulldog, it's important to seek veterinary care immediately. Early detection and treatment can lead to a better outcome for your furry friend. Diagnosing IVDD in French Bulldogs. If your French Bulldog shows signs of IVDD, your veterinarian will perform a physical exam and diagnostic tests to confirm the diagnosis. These tests may include X-rays, to look for any abnormalities in the spine or vertebrae, CT scans or MRI, to get a more detailed view of the spinal cord and discs, myelogram, a dye is injected into the spinal fluid to make the discs more visible on X-rays. Treatment options for IVDD in French Bulldogs. The treatment will depend on the severity of the condition. Mild cases of IVDD can often be treated with conservative methods, such as rest, medication, and physical therapy. Frenchies with more severe cases may require surgical intervention. As with any surgical procedure, there are risks associated and should only be performed by a skilled and experienced veterinary surgeon. Hemilaminectomy. During a hemilaminectomy, a portion of the affected vertebrae is removed to relieve pressure on the spinal cord. Ventral slot surgery. The procedure involves making a small incision in the dog's neck and removing a portion of the affected vertebrae to relieve pressure on the spinal cord. This can help to reduce pain, improve mobility, and prevent further damage to the spinal cord. Dorsal laminectomy. This is similar to a hemilaminectomy in that it involves removing a portion of the vertebral bone to relieve pressure on the spinal cord. However, with a dorsal laminectomy, a larger portion of the lamina is removed, which provides greater access to the spinal cord. Disc fenestration. The disc is punctured to remove the bulge and reduce pressure on the spinal cord. Post-surgical care and recovery for French Bulldogs with IVDD. If your French Bulldog has undergone surgery for IVDD, they will require proper post-surgical care and recovery to ensure they heal properly. Your veterinarian will provide specific instructions, but here are some general guidelines to keep in mind. Keep your Frenchie confined to a small area to prevent them from jumping or running around too much. Limit activity for the first few weeks after surgery, and gradually increase exercise as recommended by your veterinarian. Monitor your Frenchie's incision site for any signs of infection, such as redness, swelling, or discharge. Administer any prescribed medication on schedule, including pain medication, antibiotics, and anti-inflammatory drugs. Attend any follow-up appointments as scheduled, and report any concerning symptoms or changes in your Frenchie's behavior to your veterinarian. Long-term management strategies for French Bulldogs with IVDD. After your Frenchie has recovered from surgery, it's important to implement long-term management strategies to prevent future episodes of IVDD. Here are some tips to keep your Frenchie healthy. Maintain a healthy weight. Obesity is a risk factor for IVDD, so make sure your Frenchie is at a healthy weight to reduce the strain on their spine. Regular exercise. Regular, low-impact exercise can help keep your Frenchie's muscles and joints healthy and reduce the risk of IVDD. Proper diet. Feeding your Frenchie a balanced diet with plenty of vitamins and minerals can help keep their bones and joints healthy. Keep your Frenchie's spine aligned. Avoid activities that put stress on your Frenchie's spine, such as jumping or climbing stairs. Use ramps to help your Frenchie access elevated surfaces. Massage and physical therapy. Gentle massage and physical therapy can help improve circulation and muscle tone in your Frenchie's back and hind legs. By following these long-term management strategies, you can help prevent future episodes of IVDD and keep your Frenchie healthy and happy. Preventing IVDD in French Bulldogs. While IVDD cannot be prevented entirely, there are steps that you can take to reduce the risk of it occurring in your French Bulldog. One of the most important things you can do is to maintain a healthy weight for your dog. Excess weight puts added stress on the spine and can increase the risk of disc problems. Regular exercise can also help keep your dog's spine and muscles strong. Another important step is providing your French Bulldog with a healthy diet with plenty of vitamins and minerals. A diet rich in omega-3 fatty acids can also help keep the spinal cord healthy. FAQs. If you have more questions about IVDD in French Bulldogs, here are some commonly asked questions and their answers. What are the symptoms of IVDD in French Bulldogs? The symptoms of IVDD in French Bulldogs can vary but may include a reluctance to move or jump, dragging of the hind legs, back pain, and loss of bladder or bowel control. If you notice any of these symptoms in your French Bulldog, it is important to seek veterinary care immediately. Can IVDD in French Bulldogs be cured? There is no cure for IVDD in French Bulldogs. However, with prompt veterinary care and proper treatment, it can be managed effectively, and your dog can still lead a happy, healthy life. Are there any alternative treatments for IVDD in French Bulldogs? Alternative treatments for IVDD in French Bulldogs include acupuncture, chiropractic care, and physical therapy. However, it's important to note that alternative treatments should only be used under the guidance of a qualified veterinarian and should not replace traditional medical care. Conclusion: IVDD is a serious condition that can cause pain and mobility problems for French Bulldogs. While IVDD cannot be prevented entirely, taking steps to maintain your dog's health can help reduce the risk of this condition. Remember, if you suspect your French Bulldog may have IVDD, it's essential to seek veterinary care immediately. Early intervention can improve your Frenchie's chances of recovery and prevent further damage to their spine. If you have any further questions, don't hesitate to consult with your veterinarian. Thank you for watching. To read the full article, go to bulldogpros.com.